Yo, what's up YouTube? It's your boy Dr. James D, the Fresh Pharmacist. So I'm coming at you today with a slightly different segment. We're going to call it the Douche of the Day. So what do you mean by the Douche of the Day? Well, I'm sure as the name suggests, you kind of have a little bit of an inkling what I'm talking about. But for those of you who don't, let me break it down. So we're just going to go over week to week or month to month, just different types of people who are not looking out for the public's main interest. These pharmaceutical companies, big pharma CEOs that are looking out for basically themselves. So being in this type of pharmaceutical industry, you find a lot of people that are just about the money. Billions and billions of dollars are made each year at the public's expense, and in most cases it's just not right. But let me break it down. As far as the douche is concerned, we're talking about those money hungry, unempathetic, sociopathic, just looking out for themselves and their constituents and shareholders. Those are what we refer to as douches. So that being said, what's the douche of the day this time? Well, how about Insys, or Insys Therapeutics? So Insys Therapeutics, well, they make a particular medication called Subsys. Now, there's a few different words or terms, so let's just break it down a little bit. So Subsys is basically it's a very strong or potent opiate medication. Now, the thing about Subsys is it's not your normal oral pill or your patch that you normally use for your pain. This one actually is basically it's an oral spray that you spray under the tongue to help with any sort of breakthrough pain that a lot of cancer patients might use. So it's not for the general public, people who might have just an occasional pain. This is one of the strongest pain medications, period. So for this particular medication, it can be pretty expensive. So just for a small 30-day supply, you're looking between $3,000 and $30,000, like I said, just for 30 days. All right, your insurance isn't covering it. So as I'm saying, this pain medication can only be used for a certain subset of the population. Those basically that have cancer and can't be treated, or their pain managed by the typical medications that we use to treat it. So here's a little bit of a background. So what normally happens when you need medication, your doctor writes it on the prescription pad, hands it to you, you take it to the pharmacist, and either A, the doctor's office, or B, the pharmacy or pharmacy staff, you're gonna call the insurance and say, hey, Mr. Smith has disease A or cancer B or whatever the case may be, and then once you tell the insurance, they'll either A, deny it, or B, give you the okay. So typically what happens is that the doctor writes for this drug Subsys, which is normally not covered. What happens? We give them a call, we smooth it out, they give us the okay, you get your medication paid for by your insurance. But, which is the main case of what's going on here, Subsys typically isn't covered. And what's been happening is, Insys has been calling the insurance company, of which that's not even remotely close to what they should be doing or in their scope of practice. They have no business calling the insurance company. But they talk to the insurance company, they smooth things over, and somehow they get the insurance company to cover the medication. And so you're wondering, when the lady calls the insurance company, how the heck do they get them to pay for it? Well,
because she's lying to you. That's why. You understand me?
They're lying to you.
You're a real hooker, and I'm gonna slap you in public.
So basically, Insys is calling up these insurance companies saying, hey, we're at the doctor's office, and then they tell them the patient has the disease and get it covered. We call that fraud, actually. So this is how evil these companies are. So Insys would have some of their people call these doctors' offices, and so when they call you, they scramble the phone numbers so you can't see where the number of the company is coming from. That's one. And part two is, if you ask for a callback number, they're gonna give you a 1-800 number, and when you call that 1-800 number, guess what? It's gonna be my colleague or my coworker sitting right next to me picking up the phone and saying, hey, this is the doctor's office. And part three, when they do call back and they ask them, hey, what's the diagnosis? What's wrong with this patient? They don't technically say that they don't have cancer, but they kind of spin it so that you're gonna think that the patient has it. What is wrong with you people?
Huh? What do you mean, you people?
What do you mean, you people?
Huh?
Okay, so check this out. There's actually an audio recording recovered by CNN showing Insys, the corporation, talking to your insurance company, tiptoeing around the possibility that you might have cancer, knowing good and well you don't. But they're doing everything that they can to make sure that the insurance covers you. So but they'll never actually say that you don't have cancer, but they're just gonna push it until you cave. So check out this audio clip. It's pretty bad.
Requires authorization, and if it does, if I could do it over the phone, it's urgent.
Oh, okay. You're calling from the doctor's office then, correct?
Yeah, Dr. Madelon's office.
Okay, and what is the diagnosis for the patient?
Let me look through here. See. Management is intended for the breakthrough medications intended for the management of breakthrough cancer pain. The doctor's treating the patient.
Okay, so check this out. So why is it important? Well, it's important because you have a lot of people doing a lot of douchey things. And it goes from the bottom all the way to the top. It starts off with the pharmaceutical company going to your provider, going to your physician and saying, hey, we'll give you this money if you write for this prescription for Jane Smith, who doesn't have cancer, which again is the only reason you should be getting this medication. But if you write the medication and give it to her, we'll give you some money and we'll take care of the rest. Meanwhile, this Insys Corporation, they're gonna call your medical provider and lie to them saying you have cancer so that they'll actually pay for it. Another form of fraud. Meanwhile, since you don't have cancer and you may not need a drug that strong, you're getting one of the most potent medications in our medicine arsenal. And what happens? You increase your chances for an overdose, which is exactly what happened to Karen Hill. She was only 32 years old and she didn't have cancer. And guess what? She took the medication, husband found her dead face down on the floor. And that is a level of douchiness I couldn't even imagine aspiring to get to.
Oh, God, these motherfuckers right here. How am I? Oh, doing these. I'm gonna get them. I'm gonna get them. These. Tell me, not you though. Oh, I'ma bust all you niggas in the lip.
So big picture, y'all. What did these douchebags do? They falsified medical records. They gave doctors kickbacks. They imitated being a doctor's office. They hurt people and their loved ones. They charged an outrageous amount for the medications. From a company that's supposed to be helping people by providing medication that can soothe their pain. You're actually causing more. But you guys are so evil, so evil. But you're going down today.
You go around and you disrespect old people. Well, you ain't getting away with it this time, young punk. You going down today, boy. This boy going down today, boy. He gonna go down to the ground, to the ground, to the ground, down today, boy.
And that's why you guys are the douches of today. Ooh, I started out with multiple douches, not just one. Go ahead, James. Yeah. I'm out. Peace. Y'all about to make me mad.